Abnormal psychology is the branch of psychology that essentially tries to explain characteristics and patterns of thought that are unusual in most contexts, but can be elaborated on more so with the labels of mental illnesses. The DSM-5, which is the Bible of this subgenre of psychology in America, identifies different groups of disorders, subtyping them into many categories, including the 4 groups I will talk about today: mood, schizophrenic, anxiety, and personality disorders. Within the first group of mood disorders, one stands out that you may know as major depressive disorder, or just depression simply, which 1 in 6 people experience at some point in their life, but 1 in 15 will experience in any given year. For women, however, statistics believe 1 in 3 women will experience a major depressive episode in their lifetime. Major depressive disorder is signaled with at least 5 symptoms of a major depressive episode, lasting more than 2 weeks, the symptoms of which include persistent negative mood, diminished satisfaction or pleasure from nearly all activities, significant weight loss, suicidal ideation, feelings of worthlessness, and a few others that are listed in the DSM-5. Bipolar disorder is another term that is more popular. The idea of this disorder is that it is characterized by dramatic mood swings between mania or hypomania of type 2 or cyclothymic, which is the up of the disorder. Mania is characterized as a period of greatly elevated mood, including increased activity, energy, or irritability lasting at least a week, while hypomania is essentially a lesser version of that. K. Redfield Jamison, an American psychologist and author who suffers from bipolar disorder, explains the manic episodes in her book titled An Unquiet Mind as, "The ideas and feelings are fast and frequent like shooting stars, and you follow them until you find better and brighter ones. When that's all over though, what goes up must come down." And the about 2.6% of the US population that experiences bipolar disorder, along with mania, also experience a major depressive episode, due to what I'd believe is your body attempting to equalize your neurotransmitters due to the manic episode. Jamison describes the depression as well in the memoir, stating that it causes you to feel irritable, paranoid, humorless, lifeless, critical, demanding, and that no reassurance will ever be enough. Both major depression and bipolar disorder have been acknowledged to be slightly heritable, meaning that if someone has a relative with one of the disorders, they're more prone to being diagnosed with it as well in their lifetime. Treatments for both of them include selective serotonin reuptake inhibitors as a biomedical approach, as well as clinical therapy as a psychotherapy approach. And with that, we're moving on to the next group of mental illnesses, including schizophrenic. And schizophrenia is a spectrum disorder that can fall into many different categories, including catatonic, paranoid, disorganized, undifferentiated, and residual schizophrenia, the last 2 of which we won't focus on. Catatonic is seen as a rare subtype of schizophrenia because it is believed to be largely the result of untreated schizophrenia, showing that refusal to treatment, or even the symptoms not being noticeable enough for a diagnosis of schizophrenia, can end up causing it. Catatonic schizophrenia is indicated by 3 or more symptoms of a list, including inability to speak, stupor, and mimicking of others' words or expressions constantly. Paranoid schizophrenia is a subtype that is shown through what are called positive symptoms, positive being in quotations, including hallucinations where they may see Jesus behind the counter at a 7-Eleven and delusions where they may think that they're actually the Queen of the United Kingdom. But enough about my aunt. The third archetype of schizophrenia is disorganized. Disorganized or hebephrenic schizophrenia is shown by signs that many people believe to be the typical schizophrenic signs, including inability to feel joy or happiness, inappropriate responses in social situations, or inability to manage day-to-day issues such as hygiene, household tasks, and work. While schizophrenia has a very low prevalence, being between 0.33% to 0.75% internationally, it is still one of the top 15 causes of disability worldwide. The average age of onset for schizophrenia has been determined to be earlier in males, with late adolescence to early 20s being the average, and later in females, with early 20s to early 30s being the average. Schizophrenia can either be caused by genetic predisposition, trauma, or an irregular brain structure. Treatment for schizophrenia is often lifelong, and the most common form of treatment is to be prescribed antipsychotic medications, which work by affecting the ability of the brain to process dopamine, the neurotransmitter that's believed to be the cause of many symptoms of schizophrenia. The next group we'll be talking about are anxiety disorders, which are much more than just social anxiety and being scared of spiders, although both of these, however, can be classified as anxiety disorders. Phobias, general anxiety, and panic disorder are a few examples of different anxiety disorders. According to the DSM-5, the symptoms of the specific disorder must last at least 6 months and include negative behaviors that affect the person's day-to-day lifestyle. Phobias vary across a wide range, but they are characterized by disproportionate fear response to a specific object or situation. An example of a phobia would be agoraphobia, the extreme fear of at least 2 scenarios from a list of using public transportation, being in open spaces, claustrophobia, being in a crowd, or being outside of one's home alone. General anxiety disorder, or GAD, is specified as the feeling of inordinate worry about a variety of scenarios, which must occur more days than not for 6 months at least. The difference between the occasional anxiety that everyone experiences and general anxiety disorder is that GAD's anxiety is more extreme, where it controls their daily work and tasks, often causing physical symptoms such as insomnia, trouble concentrating, headaches and migraines, fatigue, and trembling or twitching. Panic disorder is an anxiety disorder that causes panic attacks, where someone may experience sudden feelings of terror when there is no real danger. Symptoms of panic attacks include fast heartbeat, difficulty breathing, weakness or dizziness, sweating, and chest or stomach pain. People who may experience a panic attack for the first time generally feel as if it will kill them, although panic attacks aren't inherently fatal. The feeling of impending doom generally appears to be fatal to the patients. The fear of another panic attack can often make people avoid the places they've had panic attacks, to a point where they may even develop phobias of social settings or even develop social anxiety due to the panic disorder. Age of onset for anxiety disorders differ among the specific disorder. Phobias at age 7, panic disorder at age 24, and GAD at 30. Treatments also differ among the specific disorders, but most can be helped with cognitive behavioral therapy to reduce anxiety symptoms by teaching people to manage their worries with coping mechanisms. Sometimes, however, medications may need to be used, the most common being antidepressants like SSRIs. In rare cases, however, benzodiazepines, which are sedative medications by nature, can help relieve acute anxiety on a short-term basis, although they are highly addictive, prompting physicians to attempt to use them as a last resort rather than a first. We're going to be finishing this video off with one last section, the personality disorders. Personality disorders are likely the most challenging to identify and likely part of the biggest gray area in the world of abnormal psych. Unlike other disorders where people who have them are generally aware there's a problem, personality disorders are egosyntonic, where the person experiencing them doesn't think that they have a problem. Because there are so many personality disorders listed in the DSM-5, general, paranoid, schizoid, schizotypal, antisocial, borderline, histrionic, narcissistic. I'm not going to keep going with this. We're only going to use 3 for an example. The first of which we're going to talk about is paranoid personality disorder. Paranoid personality disorder is indicated by a pattern of pervasive distrust and suspiciousness of others. People who have this disorder are likely to assume that the motives of others are always malevolent and that everyone may be out to get them. Even with a lack of evidence, the person may believe that others are hostile towards them or look at anything that happens to them in the most negative light possible. Paranoid personality disorder falls into cluster A with 2 other personality disorders, including schizoid and schizotypal disorder, which are all described by odd or eccentric personality characteristics. The next disorder resides within cluster B, identified by dramatic, emotional, or impulsive personality characteristics, which includes borderline, histrionic, narcissistic, and another we'll be talking about today, which is antisocial personality disorder. Antisocial is defined by a pattern of disregard for the rights of other people that often manifests itself as hostility or aggression. People who have APD are also known to lie and manipulate others. Ted Bundy, the famous serial killer from Vermont who had confessed to 30 homicides, is likely one of the most famous people who had antisocial personality disorder. Because we can't properly identify symptoms, different signs of a person with this disorder include people who may engage in reckless and selfish behavior, including burglary, murder, and arson in the most extreme cases, while kleptomancy, manipulation, and anger issues can be more tame signs. The third and final disorder closing this video off will be avoidant personality disorder. This disorder is within cluster C, along with dependent and obsessive compulsive personality disorders, all of which are classified as the anxious and fearful disorders. Signs of this are oversensitivity, reluctance to speak to new people, and poor self-image, to name a few. A person with avoidant personality disorder is likely to avoid social situations. The name is pretty self-explanatory. But nonetheless, the easier to identify signs include strong fears of rejection and judgment against them, almost immobilizing them when they are in situations where they must speak to new people. This group of disorders is caused by both the genetics of an individual as well as their upbringing, meaning that you are more likely to have one if a relative has one. You are also at a greater risk if you are brought up in an abusive or unstable home during your childhood. There is a very wide range of treatments for the personality disorders, about as wide as there are many different disorders within it. They can range from antidepressants, mood stabilizers, antipsychotics, anti-anxiety, basically anti-anything for the medication segment of it. Psychotherapy is also a very useful tool as it can help people learn more about their condition and learn how to cope and manage the disorder. In the most serious of cases, as well as with almost any psychological disorder, the only way to really treat it can be through inpatient care at a hospital, as some with one of the disorders may be unfit or too dangerous to live on their own. Well, that's it. We're finally done. There's always more to look into in the world of psychology, however, as it's constantly advancing. Likely there will be no end to all the ideas that are added on to our prior thoughts of it. I'd like to thank you for watching this video, and as well I'd like to thank my general psychology teacher, Mrs. Bovey, for getting me a lot more interested in the specific branch of psychology. Today we've covered a wide array of abnormal psych disorders from different groups, including mood, schizophrenic, anxiety, and personality disorders. Like always, I'm Matt. Have a beautiful rest of your day.